Welcome to Doctors on Call. I'm Jenna Miller. Gastroenterology is the branch of medicine focused on the digestive system and its disorders. The digestive system is a complex structure that can be disrupted by disease, diet, and emotional stress. Common digestive problems cause millions of Americans to suffer daily and limit quality of life. Digestive problems can potentially result in symptoms such as bloating, diarrhea, gas, stomach pain, and stomach cramp. Chronic care refers to medical existing condition or long-term. Pain attacks the human body at every vulnerable target: muscles, bones, and joints. Each person and their pain are unique. More than 20% of American adults suffer from chronic pain. The best way to manage your case may be very different from what someone else's. Gastroenterology and chronic care, those are our topics today on Doctors on Call with our guest, Dr. Tyrel Summers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Tyrel Summers received his medical degree from the University of Kansas School of Medicine in Kansas City. He completed his residency at the University of North Dakota Center for Family Medicine, Bismarck, North Dakota. Dr. Summers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Summers has been affiliated with Russell Regional Hospital since 2015. Give us a call at 800-337-4788, toll free, if you have any questions regarding gastroenterology or chronic care. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you for joining us again, Dr. Summers. Let's go ahead and get started with some questions. Tell me, first of all, why would a person be referred to gastroenterology?
Yeah, so gastroenterology, as mentioned at the beginning of the show, is the study of the digestive digestive organs, the stomach, the small intestine, large intestine. It can also be the liver, the pancreas. The spleen is also included in that area. And you can be referred to a gastroenterologist if you need additional workup or if you need additional kind of services that your primary care doctor may not be able to offer. For instance, sometimes like colonoscopy or EGDs, which are upper endoscopies, may be needed. Specialized tests can be done through a gastroenterology service. Also special liver tests and liver treatments can be done through a gastroenterologist. So there's a myriad of reasons why you would need a gastroenterology specialist over just your regular primary care provider.
What are the most common signs and symptoms of gastrointestinal disorders?
Yeah, so one of the most common signs that we see with people is problems with like nausea or vomiting, which typically affect like the upper GI tract. Also, pain is another really common one that can cause problems with the upper GI tract. The lower GI tract, we normally see like diarrhea, constipation, or abdominal pain as well. For other etiologies, pain is a really common presentation also. Sometimes people can have bloating. Sometimes individuals can have conditions such as jaundice and other problems that can be present because of gastrointestinal distress. Sorry about that.
Sure. What are some signs of bowel problems?
So the biggest sign of a bowel problem especially is like constipation, diarrhea, and abdominal pain. I tell patients all the time, even if your abdominal pain might be kind of mild to moderate, that doesn't necessarily mean that there's not something underlying that could be a problem. Severe abdominal pain by far is something that needs more urgent, more emergent kind of evaluation. But even small intermittent episodes of pain can sometimes be a cause for different things that could be causing issues. So seeing a primary care provider, seeing a gastroenterologist, or somebody to discuss those things may be beneficial.
And at what point do you suggest or recommend a colonoscopy?
So colonoscopies are really important for both workup of underlying gastrointestinal discomforts and also problems, but they're also important for screening for colon cancer. So we'll talk about both of those right now. As part of the workup for a gastrointestinal workup, we were looking specifically for like problems that can only be diagnosed on colonoscope. So for example, inflammation, sometimes problems with like the colon wall itself can only be visualized using a scope specifically. In fact, there are some diseases where you can really only see them when you take a sample from the intestinal tract and send it off to look underneath the microscope. And so it can be hard even with the colonoscopy to really see those things. So sometimes if you're having uncontrolled diarrhea or you're having intestinal pain, it might be part of what we do to kind of look and see what's going on. Now, as far as screening for colon cancer, that's a very big thing in regards to kind of a preventative medicine that can be done for an individual. We recommend at the age of 50 starting for screening for colonoscopy to screen for colon cancer. Colon polyps and colon cancers that are detected earlier are easier to treat and they're easier to take care of. Finally, if you have a family member who had colon cancer at an earlier age, they recommend beginning screening 10 years before their diagnosis. So for example, if you had a relative that was diagnosed positive with colon cancer, not colon polyps, at the age of 52, we would recommend that you start colonoscopies at 42 rather than the 50 that I mentioned earlier.
Okay, let's talk about probiotics because we hear a lot about the antibiotics. So what are probiotics and how can those benefit a person with digestive disorders?
That's a great question. So probiotics are basically bacteria that we've isolated that are considered to be good and healthy for the normal flora within the gut. Now when I use the term flora, what it means is the natural biome, the natural bacterial that's present within the stomach, within the intestines. That's a completely normal and healthy phenomenon. In fact, they're very important in regards to your immune system, but also absorption of different nutrients, absorption of different calories. Without your normal biome, you can have a lot of problems. Antibiotics can really deplete the flora within the intestine, so it's really important that when you're taking antibiotics, or also too when you're struggling with some gastrointestinal things, that you supplement with probiotics because they can help restore that natural flora and help kind of prevent some of the symptoms you can sometimes see within the stomach itself.
Now, patients often are on an antibiotic just for 7 days, 10 days, and then they go off. Is that the same way that probiotics work, or can a person be on them long term?
So probiotics can be used long term. I definitely recommend for most of my patients that take antibiotics that a supplemental probiotic is healthy and okay to do. And probiotics come in multiple different forms too. There are probiotic pills that you can purchase over the counter. Some are better than others. For example, like there's some that have only one single bacteria within them, and then some that have multiple bacteria within them. I always recommend the more bacteria that you can find it, the better, because that's much more healthy and much more like your own normal flora. But yes, whenever you take an antibiotic, taking a probiotic is safe and okay, and I recommend for some individuals that have underlying gastrointestinal discomfort or problems, that a probiotic may be needed every single day. That's best to discuss with your primary care provider, but I definitely recommend them quite often.
Okay, very good. We want to remind our viewers that we're talking about gastroenterology tonight with Dr. Tyrel Summers. Give us a call at 800-337-4788. We've got a caller on the line right now ready to ask a question. This is Julie on the line from Hayes. Hi, Julie. Go ahead with your question for Dr. Summers.
Hi, good evening. I sometimes have a hard time digesting food. I kind of get a little bit of a upset stomach after I eat, and I was wondering your thoughts on digestive enzymes.
Yeah, that's a fantastic question. Thank you so much, Julie. So digestive enzymes are sometimes provided to individuals to help kind of break down some food and make sure that they get the nutrients and the calories that they need from it. Most individuals that get digestive enzymes who absolutely need them are those who have pancreatic disease or have very severe liver disease. Most of the time, again, that's regulated by a gastroenterologist, but sometimes a primary care provider that knows a lot about gastroenterology can sometimes provide those. For most individuals, though, they're not really necessary and not really needed. What I recommend for most people that have a problem with just like bloating or discomfort after eating, the big thing is making sure that A, you're taking your time, and then B, that you're eating a nice balanced meal. Because sometimes when you have too much of a specific kind of calorie, like if you have too much of a carbohydrate, too much of a protein, that can cause some problems and some discomfort. The other thing too is to make sure that you're drinking lots of water while you're eating, because that can also kind of fill you up and reduce that bloat, reduce some of the discomfort that you're having. If you continue to have discomfort, especially after eating, it can also be a sign of gallbladder disease. And making sure that you don't have any problems with your gallbladder is also very important.
Very good. Before the question, we were talking about the probiotics, and you were talking about the different forms that are there some foods that can act as a probiotic?
That's a wonderful question. Absolutely. There are good foods that actually act as probiotics and probably work even better than probiotic supplemental pills. The majority of them are ones that are like yogurt, those kind of things. They're often fermented. That's the word I was looking for. Kefir is another one that a lot of people supplement and drink. It's a fermented milk. There's also things like kimchi, kombucha, those types of products that all have fermentation to them that have a lot of natural bacteria within them as well. One that people think has a lot that's really good is vinegar, but I'll be truthful with you, the acidity of vinegar often kills a lot of the good bacteria, and so supplementing with vinegar alone doesn't necessarily help from a probiotic standpoint. Some of those other things, though, are very good. If you're supplementing with yogurt, I do remind people, though, to look very closely at the yogurt itself, because there'll be a little message on it that says contains live active cultures. That's the buzzword you want to look for. If it doesn't say that, it probably doesn't contain enough of a probiotic to really be beneficial for you. So again, look for that phrase, contains live active cultures.
Okay, good advice. Are there any supplements that can treat intestinal inflammation?
Yeah, so there's a lot of different things that are helpful for intestinal inflammation. By far, the biggest thing I tell most individuals is making sure that you eat a balanced food, kind of a balanced diet to make sure that you're not having problems. Normally what ends up happening is a person becomes too low on like fiber. Sometimes they become too low on other nutrients, and that can cause a lot of upset stomach and cause a lot of inflammation. So changing the way that you're eating and changing the amount that you're eating can be extremely beneficial. As far as supplements, things like that can be beneficial. A lot of people believe like cumin helps a lot with the intestinal discomfort. There hasn't been any study directly related to that, but it can be beneficial. I also know some people use like lavender and other things for it, which has been shown to be beneficial too in some individuals. But frankly, if you're having a lot of discomfort, if you're having a lot of inflammatory problems, seeing a provider is never a bad thing, so they can do a little bit further workup using blood tests, imaging, and all sorts of other things to find out what's going on.
How common is chronic constipation?
So chronic constipation is very common, especially in America, where we have individuals that take multiple medications. I don't recall the exact figure, but I know individuals that take more than 3 or 4 medications are at a much higher risk for chronic idiopathic constipation, or CIC. Another real big common cause of chronic constipation is irritable bowel syndrome. There's 3 different types of that, and constipation is one of those 3 types. It's very, very common and happens because of dryness that can occur within the bowel walls themselves. There's good treatments, both over-the-counter and prescription-based treatments that help with constipation. Most of the over-the-counter things are fairly effective, but the one that I use most commonly is the medication, I guess the supplement, Miralax. It's a very good laxative that also provides a lot of bulk with water because it has to be taken with a liquid. And so if you're suffering from constipation, it's a good start to try. Some other things like Colace, I find not to be as beneficial, but you can try. Senecot, which is another one that's common over the counter, can be beneficial. But again, I think Miralax by far is the safest one that provides the most benefit while also bringing a little bit extra fluid to the party, which is very helpful in people who have constipation.
Okay, what about lactose intolerance? What can a patient do if they, or how do they first of all find out that they might be lactose intolerant?
That's a great question too. Lactose intolerance is pretty common, especially in the Caucasian population of America, and so it's very prevalent. For most people it can be very minimal, for some other people it can be very severe. For the severe individuals, there is blood testing that can look and determine if you're truly lactose intolerant or not, and your primary care provider or gastroenterologist should be able to do those kinds of blood tests. Unfortunately, it's not definitive, and it's not 100% if you're having a much more mild lactose intolerance. For most individuals, what I tell for them is it's best to try an elimination of lactose to see if they improve. So for example, if you have a problem with increased flatulence, a problem with bloating, a problem with discomfort, especially after having a dairy product, it's not a bad idea to try to eliminate dairy for a few days and then reintroduce it. And if the symptoms come back, it's likely that you have a lactose intolerance, and trying to supplement with some things that don't contain lactose or that have had the lactose removed can be very beneficial. There are a lot of new products on the market that have an elimination of lactose and have allowed people that previously couldn't have milk to now enjoy milk and to be able to have it without any difficulty.
Okay, we want to remind our viewers that we are talking about gastroenterology tonight with Dr. Tyrel Summers. Give us a call at 800-337-4788 if you have a question. How do you test for digestive problems? Is there blood involved?
Yeah, so blood testing is one of the first things that we normally test for. Liver function tests especially are a common thing that we look at. We also look at renal function tests. We'll look at the amount of protein that's within the body. There's specific enzymes if we're worried about the pancreas that we can test and make sure that they're within normal limits. Sometimes if we're worried about certain colon cancers, there are specific tests that you can do. Imaging is another really important aspect of evaluating an abdomen. Sometimes we can do that with just x-rays, but most of the time we need a little bit more definitive test. And the best way to do that is with a CT scan. It shows us in 3 dimensions the entire kind of layout of the abdomen, and we can see problems live at that point, whether that be the appendix, whether that be the colon. It's hard to say what you might find, but a CT scan is really important.
What can you tell us about celiac disease?
So celiac disease specifically is a disease that has problems with gluten absorption, but it's also one that's linked to hereditary kind of problems. Most of the time we see it in patterns within a family itself, but it can cause a lot of problems. In fact, not only does it cause problems with digestion of gluten, it can cause problems with really bad rashes, it can lead to difficulties with liver dysfunction, and it's a very, very hard to treat disease. For most individuals with celiac disease, they are the ones that definitively need a gastroenterologist to help with them. While their primary care provider might be able to diagnose it, management is best left up to those who specialize.
And what are the symptoms that might be red flags?
So the biggest thing is just similar to lactose intolerance. If an individual is having a problem with gluten and they have a lot of issues digesting gluten, pain, bloating, increased flatulence, diarrhea, constipation sometimes, all of those things can sometimes be linked with celiac disease. Sometimes they'll actually start with a rash. It normally starts on the hands. Sometimes they can also have problems with their liver function tests, in which case the blood work that we talked about will be abnormal. Regardless, there's a ton of different signs that are there, and if you're worried about that, that's definitely something that you can discuss with a primary care provider.
And if a person with celiac disease is able to heal their intestinal tract, is there a chance that they can ever reintroduce gluten into their diet?
Normally not, to be honest with you. It's normally a lifelong allergen. You can do some things to help modulate and mitigate that, sorry. But to be truthful with you, for most individuals with celiac disease, it just means the avoidance of gluten. That's by far the safest way, because normally what ends up happening when you reintroduce it, it just causes the same inflammation, the same problems that it did before, despite treatment.
And more I feel like you're seeing the shelves in the grocery store have many gluten-free options.
Yeah, and you know, gluten intolerance is another big thing that we don't really talk about as much. We all assume everyone has gluten problems from like celiac disease, but truth be told is there's a lot of people that don't break down gluten as well. And so having gluten-free options is a very important thing. It gives people the ability to try to eliminate it to see if it will help. Because gluten intolerance can cause a problem with like bloating, it can cause problems with increased gas production, it can cause problems with abdominal pain. So it's again kind of like the lactose intolerance thing. If you can try to eliminate it and it makes your life feel better, it makes your stomach feel better, it's probably that you just have a hard time breaking down gluten, which can occur.
Okay, we're back to the phone lines now. We've got Yvonne on the line from Great Bend. Hello, Yvonne. You can go ahead with your question for Dr. Summers.
Okay, my doctor recommends that I am on calcium and quite a lot of calcium and vitamin D. And I was, it constipates me so bad. And so then I feel like I have to take Miralax or milk of magnesia. I wonder if there's any answers to that.
Thank you so much, Yvonne, for that question. Definitely calcium and vitamin D are important for supplementation, especially for bone health. And so if you have a diagnosis of like osteopenia or osteoporosis, which is problems with your bone mineralization, those two supplements are very important. You need those vitamins. But you're right, in some individuals that can cause a pretty severe constipation, which can be difficult to deal with. There's no real way to get around supplementing with calcium and vitamin D, though. Unfortunately, there's no like IV infusions that are reasonable that would be good for you to try. It all has to be taken orally, and because of that, it can constipate. So what you really want to do then is make sure that we're staying on top of a good bowel regimen and on top of good bowel health. The other thing that might be beneficial to you is increasing your fiber intake. Sometimes by increasing your fiber intake, that can make your stool softer. That can also make it a lot easier for you to go on top of it. But always, Miralax is by far my go-to medication. I think it's very good for people who have chronic constipation and is relatively safe to take daily if you need to. And if you take calcium and vitamin D daily, you might have to supplement with Miralax daily, unfortunately. But yes, Yvonne, they're very important things you can't stop, and unfortunately there's no real way to get around the constipation.
Now you mentioned fiber intake, increase that. What are some good options to increase a person's fiber?
So fiber is found in a lot of kind of leafy vegetables. It's found in a lot of the different vegetables that are present, but it's also present in legumes. It's present in like whole wheat products, and so that's why you see like a big push towards like all the nutritionals trying to get people to eat more whole grains because it has a lot more fiber into it. And fiber just helps for a lot of different reasons. As I mentioned earlier, it softens the stool to make it easier to pass, but also it helps make sure that by having softer stool, it doesn't cause complications with things like diverticulitis or diverticula later in life. The other thing that's really important for fiber is it's slightly kind of kinetic. It makes stool move a little bit easier and a little bit better. So staying on top of fiber is really important. Some individuals can manage chronic constipation with just fiber supplementation alone, whether that be increasing the fiber in their diet or taking like a fiber supplement such as Metamucil or FiberCon or something similar to that. There are also over-the-counter snacks. Like Fiber One has a great like lineup of things that you can try to increase your fiber. I'll be honest, they're not nearly as good as other dietary fibers, but they also are important. Other things like oatmeal, those kind of things are also really high in fiber and can be beneficial also. So there's ways to find to increase your fiber in almost every meal.
You mentioned diverticulitis. Can you explain what that is?
Yeah, so diverticulitis happens in individuals who have diverticula. Diverticula are little out pockets that occur on the colon wall themselves, and it happens because of chronic constipation. So what happens is your bowels are squeezing, and moving around stool down the line. Sometimes the area in between muscles can get stretched, and that causes almost like a little bubble that pops out. That little bubble can harbor bacteria, it can harbor stool, it can harbor a whole bunch of stuff, and when it becomes inflamed to the point that it becomes infectious, it causes diverticulitis. Diverticulitis can be seen with abdominal discomfort, primarily in the area of the colon that's affected. So sometimes it's left lower quadrant, sometimes it's left upper, sometimes it's right upper, sometimes it's right lower. It can really be anywhere. It causes fevers at times, it can cause diarrhea, it just kind of causes a lot of distress more than anything else. So it's definitely important to try to increase your fiber as much as possible, as that can minimize your risk for diverticulitis.
What about acid reflux? Is there any way to cure acid reflux, or is there mostly just covering the symptoms?
So acid reflux is a kind of complex subject because you really have to determine what's causing the acid reflux to determine if you can get rid of it or not. For some individuals, acid reflux is caused because of a hernia. There's actually a specific hernia that can be at the top of the stomach that sometimes pushes its way upwards. If that's truly the case, they can actually go in and fix that, and that can cause a lot of resolution of symptoms of reflux disease. Another cause of reflux disease that can be cured is the infection H. pylori, which is a very specific bacteria that lives within the stomach lining itself. If you end up with H. pylori, you can do what's called triple or even quadruple therapy, which has a whole bunch of different medications that are given to you to eliminate the bacteria itself. It's a great way to take care of it. However, a lot of individuals have gastro reflux just because of medications, increased acid production from stress, or any number of different reasons. And unfortunately, then you can really only treat it. For most individuals, it's safe for you to try treatment over the counter, whether that be antacids such as Tums or Maalox or any of the other medications you can find, or even trying daily medications such as like Prilosec or Zantac or any of the over-the-counter medications. They're completely safe to start on your own. And you can monitor your symptoms. I just recommend for most people not to do it for more than 6 to 12 months without talking to your primary care provider, because there are risks for chronic use of those medications that should be discussed with them.
What triggers heartburn?
So heartburn is primarily triggered by an increase in acid production that occurs within the stomach lining itself. The stomach naturally produces extra acid to help with digestion of food and to help break down kind of the products that are within your food itself. Sometimes that can be increased because of stress, sometimes that can be increased because of disease, and sometimes that's just increased because of medications that can irritate the bowel wall and activate that ability sooner than it should have been activated. Reflux itself can be promoted because of just that irritation that occurs there and can cause the discomfort that people feel with reflux.
You mentioned stress. Can depression or stress lead to digestive disorders, have you found?
Absolutely, yeah. The primary cause for people with irritable bowel syndrome is having an underlying anxiety problem or an underlying major depression problem. And oftentimes some of the medications that we use for treatment of that are medications that we also use for treatment of major depressive disorder and generalized anxiety disorder. Now, of course, I don't want to put that all on the hat of irritable bowel syndrome. There are dozens of things that can cause irritable bowel syndrome, and definitely if you suffer from IBS-D, which is irritable bowel syndrome with diarrhea, or IBS-C, or even just mixed IBS, it's not always related to generalized anxiety and with major depression disorder. There can be other things that cause it. So while treatment of those things can definitely improve your symptoms, that doesn't necessarily mean that you have to do that.
And how do you find that, you had mentioned a well-balanced diet earlier, that can help not only with digestive disorders, but also with a person's mental health?
I'll be honest with you, a good balanced diet helps with a lot of things, not just necessarily with your gastrointestinal health or your mental health. For a cardiac standpoint, a renal standpoint, I'd be hard pressed to find a system in your body that really doesn't benefit from having a good healthy diet and making yourself active. That's why I think every time you walk into a doctor's office, we're always telling you, hey, make sure you eat healthy. Hey, make sure you exercise. Make sure you do these things, because they are honestly the best medicine that we can prescribe for people.
Okay, excellent. Well, we didn't quite get to chronic care tonight, but if Dr. Summers is able to, we'll have him back next week and we can hit on chronic care. But tonight we were discussing gastroenterology, and thank you so much for joining us. You can email us questions for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.